Thank you for coming to see us at Thames Valley Surgical Services. I'm glad your surgery was successful and you're now in your lovely recovery room watching this video and watching your aftercare instructions. We sent you an aftercare sheet and an op report for your own records, for your GP and for your nurse. If somebody else removes stitches, it is not unwise to print those instructions and take it with you. 4 side effects are worth mentioning: pain, bleeding, infections, and the stitches coming apart. Now, all of them are not that common, but many of them can be prevented. Pain can be prevented by taking painkillers. Bleeding by putting pressure half an hour to an hour after surgery, particularly after major surgery, on the wound edges, particularly if the doctor has recommended it. You can prevent infection by keeping the wound covered for 48 to 72 hours, unless you're told not to do so. For example, if it's a wound in your face or in your hair, we usually say don't cover it. So when we say don't cover it, please don't cover it, and no lotions and potions to the face. That's really, really important. But generally, most of these things can be avoided. Now, the other thing how you can avoid stitches coming apart is by not rubbing them with the towel, but by dabbing them like this. So painkillers like paracetamol are absolutely fine. Take ibuprofen as well if you need it. Sometimes some people might need cocodamol, which you can buy over the counter, which is a bit stronger, but don't take aspirin because it thins your blood. Infection isn't common, as I said before. Keep your wound also not only covered but also dry for 48 to 72 hours so proper scab can form and prevent the entry of bacteria into your cut or into your wound. That's really important to prevent infection. That's why we don't want to bring water on it. If there are any signs of infections, please use some form of antiseptic. We think always iodine dries it up nicely and is the best. Sometimes you have to order that online. Not every pharmacy has that at the moment. Now, if the infection is deep or if you had a cyst, you may have to ring me or your GP to give you a prescription for some antibiotics. Rest for at least 48 to 72 hours as well. We don't want this to swell. We don't want the bleeding to start. And don't drink alcohol so quickly. Leave it for at least 2 days and then drink with reason. And that will reduce the chance again of swelling and infection. Don't exercise for 1 to 2 weeks afterwards unless I have allowed you to do it a bit earlier. But always be aware the earlier you exercise, the earlier you put stretch onto the scar, the more likely you may have a bit of a wider scar. So if that doesn't worry you too much, then that's not a problem. But occasionally I have to say to you, don't exercise at all for some time, and please follow that advice as well. Now, if in doubt, leave the stitches a bit longer. Don't usually take the stitches out too early because, again, that makes them break open. If you leave them a bit too long, they might get a bit red, but basically it doesn't harm leave them a bit longer. So when I say, for example, 10 to 12 days, please don't remove them after 8 or 9 days. Just leave them for at least 10 days with common sense, perhaps for longer. Now, you could, for the stitch removal, obviously use a stitch removal kit, and we've also got a video in your aftercare email, or you make an appointment with your practice nurse or with us for a small fee. We also give you phone support if needed. If you live further away, that's not a problem at all. Scarring takes time. Scar shrinkage happens within 4 to 8 weeks, sometimes up to 3 months. After that time, your scar will shrink much further, so don't be too quick in assessing the outcome of your wound, because often, if you give it some time, it gets smaller and smaller. Take vitamin D 3,000 units for up to 6 weeks. Use silicone tape or plasters. Use tape perpendicular to your scar, or keep the scar a fine line. Shave, excision and cautery, including electrodesiccation of sound elasmas. Please do not touch them to avoid infection. Let the scabs fall off by themselves. Any questions? Ring us on 07973 6633 555. And also, please do give us some feedback. There is a feedback link in your aftercare email. We read every feedback. We do read and like the good one, but we also read and learn from the not so good one. So thank you for watching again. Make sure you watch this video when you come home once more and look at the email we have sent you in detail. Thank you.